Hello and welcome to vlog number 146. This week I'm going to talk about mild cognitive impairment in Parkinson's disease. On Monday I gave a talk to a local Parkinson's group in Catfield, Norfolk. The subject matter was medicinal cannabis, although I also talked about my medical history and my early experiences with recreational drugs, alcohol, tobacco, cannabis and magic mushrooms. I was talking about stuff that I'm very familiar with and have spoken about many times in the past, yet I found it necessary to write a script and read from a teleprompter, because I know from experience that my mind would be a complete blank when I was put on the spot. I've lost the spontaneous flow of words. This was something that I became aware of a decade prior to my PD diagnosis. I was talking to a group of my work colleagues in the office, and I finished off by saying, "A bird in the hand is worth two," and then my mind went blank. I couldn't recall the rest of that well-known saying for the life of me, and I remember feeling like a rabbit in the headlights as my colleagues looked at me and waited patiently for me to finish my sentence, and I simply couldn't. My blood still runs cold when I think about it, and this incident made me aware of cognitive changes that were taking place. I felt less sharp than I used to be. Although I couldn't put my finger on exactly what had changed, I was aware that something had changed. Nowadays I rely upon a teleprompter whenever I need to speak fluidly, and I struggle to contribute confidently and intelligently in casual conversation. Mild cognitive impairment, MCI, is a common, non-motor symptom of Parkinson's, even at the very early stages. But its characteristics can vary hugely in terms of the areas of cognition affected, the timing of its onset, and the rate of progression. I found the following definition in a study entitled Mild Cognitive Impairment in Parkinson's Disease by Vale, Costantini and Schrag. MCI has been defined as a syndrome of cognitive decline that is greater than would be expected for an individual's age and level of education, that does not interfere with that individual's ability to perform activities of daily life. It is distinct as an entity from dementia, where cognitive difficulties are greater and have an impact on day-to-day functioning. MCI in Parkinson's is characterised by deficits in executive function, which includes attention, organisation and planning difficulties. Difficulties with finding words, slower thinking, visuospatial dysfunction, and difficulty in learning and remembering information. You may feel confused or feel less efficient. Deep brain stimulation can affect speech, concentration and complex thinking, and I've certainly noticed some subtle, and in the case of speech, not so subtle changes since my operation 3.5 years ago. About 50% of people with Parkinson's experience some sort of cognitive impairment, although not all progress to a diagnosis of Parkinson's dementia. A reduction in the level of dopamine in the brain is thought to be one of the causes of MCI, since this neurotransmitter is involved in cognition, memory and learning, sleep and attention, as well as the regulation of movement. The cognitive deficits associated with dopamine insufficiency are usually mild. Researchers think that changes in acetylcholine and norepinephrine could be linked to memory and executive function problems in PD. Stress, depression and medication can also be contributory factors. If you have concerns about cognitive changes, then you should consult your doctor, who may change your medication or refer you to a neurologist or neuropsychologist for assessment. An occupational therapist can assist with strategies to adapt and cope with these symptoms, and a speech therapist may be able to assist with language difficulties. I think it's important to keep the mind active through mental stimulation, so I play quite a lot of Scrabble and have dabbled in crosswords and Sudoku in the past. Exercise, having a hobby and taking part in social activities are also deemed beneficial. Thanks for watching. If you have any questions or have a topic that you would like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.